Good morning, everybody. Welcome to November and a whole new month of news that we get to look at ahead for the back half of the year as we near the end, believe it or not, of 2022. One of the big stories of this fall, now going into this winter, has been not COVID this year, but respiratory illnesses like RSV and flu. And so now that Halloween is done, although candy is all over my house, we're going to kind of turn our gaze towards the holidays and how to keep your family healthy during this time. We got a lot to look through, so I'm going to show you a couple different things. Dr. Rutland's going to jump in just a second. He's going to answer your questions about what we're seeing when it comes to pediatric illnesses, and we're also going to connect this. When some believe that children are really the main vectors of transmission of all sorts of viruses that we all end up getting. So it's important to pay attention to what's going on with the littlest among us because we care about them, of course, but also it gives us a little bit of an idea of, well, what else should we be looking at for the rest of us? So before I jump into the conversation with Dr. Rutland, I just want to show you something real quick. We just heard from the CDC that flu arrived early. We had indications of that, but the CDC now is talking about it a little bit more specifically. And what you get from the CDC on a regular basis are these maps. And I just recorded this. This is over the last 2 or 3 weeks. And you can see, you're going to see the beginning of flu season, which most of the states are green. And then it gradually you see a little bit more orange and then suddenly a lot more red. This is early to see this sort of flu activity. And so this is one of the reasons why we're talking about flu. And in fact, this is something important. We actually saw the first flu-related pediatric death over the last several weeks. The CDC just confirmed that. We're seeing a higher rate of hospitalizations. In fact, the highest rate of hospitalizations that we've seen since the flu outbreak back in 2009. So the highest that we've seen in a decade. So this is why there's reason for concern. You see a map like this that has a whole lot of red on it showing that infection is present. You're seeing higher rates of hospitalizations, and we're always watching pediatric deaths, which unfortunately we do see every flu season, although it varies the degree in which we talk about the severity of flu. Let me just show you, just for perspective, this is the map of COVID in America right now, and the green is showing lower rates of community infection. So, what a contrast, isn't it, to see a COVID map like this, but then also see the flu map. I want to just have a little bit of caution, though, that last year at this time, we weren't talking about Omicron at all. We were talking about this on Scoop yesterday. If you haven't joined us on Scoop, definitely check it out. You could see it just in a link in our bio and Instagram, and it's kind of our insider group where we do a big report at the beginning of the week to prepare you. And one of the things we talked about is the fact that last year at this time, we didn't know anything about Omicron or the different variants that we'd be watching come Christmas time. So we look at this map with some humility. Let me show you one more map, and then we're going to go ahead and bring Dr. Rutland in. These are two different kind of graphs that are showing us RSV, and Dr. Rutland's going to walk us through this. Unfortunately, I can't show you this screen while he's talking, so I just want to kind of give you like a primer, and then we'll talk a little bit about this. So this is RSV cases, percent of positive tests that are taking place. The graph that you're seeing here, that where you see a big spike, is really kind of early 2021. So you can see that we're not yet back where we once were when we've been talking about RSV repeatedly during the COVID-19 pandemic. And at different times, let me see, this is detections. At different times, we've seen RSV appear around the country, like in the middle of spring or summer, where we're seeing higher rates that were confusing doctors. And we're seeing that. This is the detection of the virus. This is a 4-week moving average. So it's trying to smooth out some of the bumps and the peaks and the valleys of this. So you can see that we're on that upswing for detection. So all the more reason to talk about this. I didn't plan this, but we learned today that we got some news from Pfizer talking about their new RSV vaccine. Quick preface on this is a maternal vaccine. It would be given to the mother, and the protection, according to Pfizer, would be passed on to the baby for the first 3 to 6 months of their life against RSV, protecting against RSV. However, this is a press release from Pfizer. We don't have a study in a journal to look at. This hasn't been peer reviewed. They may be talking about bringing it to the FDA, but they also aren't the only ones. There's other companies out there that are also working on RSV vaccine because it can be so dangerous to kids. So I want to mention that. Let me read this real quick just to give us some perspective about how serious respiratory illnesses in children are this season. This is from The Atlantic. At Johns Hopkins Children's Center in Maryland, staff has pitched a tent outside the emergency department to accommodate overflow. Connecticut Children's Hospital, mold calling in the National Guard. It's already the largest surge of infectious illnesses that some pediatricians have seen in their decades-long career, and many worry that the worst is yet to come. So here we are. When we're talking about respiratory illnesses, we have to talk to a pulmonologist, which is why we wanted to talk to Dr. Rutland today. So let me go ahead and invite Dr. Rutland in. If you hear, do you hear my son? He's a big fan of Dr. Rutland. He may come in here for a second. True is home from school because all the schools have off the day after Halloween, Dr. Rutland, which is bedeviling parents everywhere in our district.
That's the way to do it. To be honest with you, it's pretty funny because my two kids are home from school today because they have a respiratory virus.
No
They
kidding.
have fevers. Yeah,
Okay, wait, did they
they
get to
do.
treat? I just
They went trick or treating last night, and then the 7-year-old, my friend brought their baby over, and the 7-year-old was like dead tired and wanted to go home, and so she got into the stroller, and I was upset because I was like, you're 7 years old, you're not a baby anymore. But she was sick. She came home, and then last night she had a 103-degree fever. So she's sick, and I knew she was sick. I could tell that she was sick just based on her behavior yesterday. And I was like, I don't know if you should be trick or treating, but she didn't want to miss out. But she was pretty much done after one or two houses. So
Oh, what do you think it is? Do you think it's just a common cold? What, as a doctor, as
I
someone
think
with
it's
your back,
I think it's
what
I
do you,
think it's RSV.
do you really?
Yeah,
Okay, so wait a
yeah.
minute, time out. How do you know if something's RSV versus a common cold versus the flu? What would be a telltale sign of that?
You don't. But the interesting thing is that when you look at RSV and the types of symptoms that it can cause more asthmatic type of symptoms because of the way the virus activates the cellular communication molecules that are involved. I literally just presented on this in Infectious Disease Week last week and at CHEST a couple of days before that in Nashville and Washington, D.C., respectively. But it's that really, but you don't know. Like when kids are sick, when kids have respiratory type of symptoms, you don't know if it's RSV, you don't know if it's a common coronavirus, you don't know if it's a rhinovirus, you don't know if it's influenza. You really have no clue. You just kind of guess. And I was just thinking of everything that was going around, thinking of my daughter had a soccer game on Saturday, and every single kid on the field was coughing and was wheezing a little bit. And I was like, man, this seems like RSV. That's what we're seeing. We're seeing a lot of RSV.
So Curtis is asking a great question, which is just,
Yeah.
can you define RSV? What is RSV?
Yeah. So what RSV is and what it stands for is respiratory syncytial virus. And it's a very common respiratory virus in children. And what respiratory syncytial virus is when you look at the structure of the virus, right? And we've talked about this a lot. And I think that the audience and individuals in general are prepared to receive this information now with the SARS-CoV-2 pandemic. But when you look at the structure of the virus, it has two proteins called the F protein and the G protein that reside on the membrane that are going to bind to your cells, right? They're going to bind in your airway. The cells that line the airway are called airway epithelial cells. And what the F protein and G protein do is they bind to the airway on certain receptors on the airway. I'm not going to get into the nerdy, geeky science that I can, but they bind to certain receptors on the airway. And then the virus fuses with the airway cell. The two membranes fuse together. And then it spits its genome into the cell. And then the cell actually leads to more replication of RSV. It borrows some of the proteins from our own cells to make more copies of itself. And then there's other types of proteins. There's actually 11 proteins in RSV, and some of those proteins are responsible for the severe symptoms in kids. And I'm going to get to this because I think this is an important message. This is why people are looking at RSV and want to vaccinate against RSV. The reason why is because some of the proteins in RSV, once they are translated, manufactured, they actually lead to the weakening of that airway epithelial cell layer, and you get the sloughing off of that airway epithelial cell layer into the airway, right? Along with all of the mucus that's being produced. And RSV leads to more cells producing mucus, so you get a lot of mucus, hence the wheezing and the coughing. and you get the sloughing off of that cell membrane. And kids, what do they die of? They actually die of obstruction, airway obstruction. So they have so many mucus plugs and it's so thick that they can't breathe, right? So they're basically, you're obstructing the pipes that allow you to breathe. And when you obstruct those pipes, you hyperventilate, can't breathe, you can't oxygenate, and you can die. And that's what most kids and adults, for that matter, will die of when you look at RSV infection overall.
And so you were saying the vaccine, the reason why people are looking to vaccinate is because they would be able to disrupt that process with the
Yeah.
vaccine.
So again, I know a lot of people are sick of hearing this term vaccine there, and I read somebody's comment that says, the answer isn't more vaccines. Actually, the answer is more vaccines. But um, what the vaccine does, right, and the way this vaccine works, the RSV vaccine, the F protein is one of the most important, if not the most important protein that binds to the cell. So what our immune system does under normal circumstances, under normal infection, is the virus infects, our immune system recognizes that the virus is infecting, and what it wants to do is create antibodies and cells that recognize certain aspects of the virus to not allow it to bind to our cells, right? That's what you want to do. So antibodies and cells in our body, like T cells and B cells, are going to recognize the F protein and the G protein. That's what happens in normal infection. You get infected, you recognize the F protein, G protein within about 20 to 30 days when you get your peak antibody levels. But within about 7 to 10 days, you start to combat and really eliminate the presence of the virus. So what the vaccine is the vaccine is actually F protein. So what we're doing is we're giving our bodies the F protein, not the virus, just the protein. And our bodies recognize it as foreign. And this is a traditional vaccine. It's not an mRNA vaccine. Our bodies recognize the protein as foreign, and they start to make antibodies against the F protein and T cells and B cells and dendritic cells that recognize this F protein. So that way, when you're exposed to the virus, your immune system already knows how to defeat it. It's like, oh, I've seen this. I got it. And you have these antibodies in these cells in the serum.
But for right now, we don't have the vaccine. And I know there's obviously a lot of strong feelings about vaccinations. In fact, we're seeing that just even the conversation about COVID vaccinations, one can say that we're seeing a decrease in the amount of parents and children that are getting vaccinated for any sort of thing. And so that'll be a kind of a separate conversation. Once we see these RSV vaccines, I really like to get more in depth on that. For parents right now, we don't have a vaccine. And really RSV can present, as you mentioned, as a common cold. I was seeing Kelly, she works in a daycare. She's on our message board right now. She's thanking us for covering this because if you're working in the school system, this is a really big deal. So it's my understanding that RSV, one of the things that's scary about it for kids is that it looks like a common cold, and then suddenly, in a course of a couple of hours, it can become very serious. So what are the signs that parents should watch for? And when will you know, for example, I mean, obviously you're a doctor, so you can treat your daughter, but what would you be watching for as a parent to say, okay, this is when I actually need to seek more additional help?
Yeah. Here's the thing about RSV, and this is what sucks, is there really is no treatment regimen that is efficacious, that is very efficacious, okay? There are certain products that are approved for children, and there's certain antibodies, but they're not extremely efficacious. The telltale signs of a kid struggling that needs to go to the hospital, okay? Excessive wheezing, you see accessory muscle use in breathing. So you start to see contractions here, right? In between your shoulders here, That's an accessory muscle because the kid's really trying to take a breath, right? And they can't take a breath. You see that. Respiratory rate, 30, 40, 50 times a minute, right? Lots of mucus production. Those are the things that scare me, right? So what do? Like, if I don't have my stethoscope because I keep it in my car, I'll listen to my daughter's lungs, right? So last night I'm listening to her lungs, and her lungs sound pretty clear. She's got really more upper respiratory type of symptoms than lower. But when the infection starts to move into that lower respiratory tract, you get the wheezing, the mucus production. That means you might need some treatment, right? You might need some treatment to calm down that inflammation. It's very scary. In fact, when I was presenting in Nashville on this topic, I went to dinner, and my old co-resident was like, I'm so glad you're presenting this. And I was like, well, what's up? She was like, dude, she's like, 9 months ago, my 18-month-old was so sick. She's a pulmonologist, by the way, was so sick, wheezing, coughing, mucus production, shortness of breath. I had to take him to the ER. He's RSV positive, and there's really not anything you can do. Like, there's nothing you can do about it. You just kind of say, the ER doctor just kind of said to me, listen, I'm sorry, your kid has RSV. It's, it's a process. He's going to be sick. Hopefully he gets better. Here are some symptomatic agents that you can take. Here's some steroids maybe you can use to help reduce the inflammation. I'm sorry. And she's a pulmonologist, right? And I was like, did you tell him you were a pulmonologist? She's like, no, I don't like to do that. And I was like, okay. Because there's nothing you can do about it, right? And so that's the thing. And listen, as somebody who's going through something in my family, right? As somebody who goes through something in my family, something that you can't really protect against, something that happens to a lot of people, and you just have to deal with it and go through the treatment regimen and all of that. Like, as somebody who's going through that, watching someone kind of suffer, watching a family kind of go through these emotional ups and downs, when you can take a product like a vaccine and you can prevent severe illness or the life-threatening symptoms, right? Hospitalizations. I just think it's a smart thing to do, because there's so many things that we can't do anything about. So many things that just happen naturally. This kind of thing, you can prevent these types of, you can prevent long-term consequences, long-term, acute hospitalization. So for me, I'm excited when I see vaccines being studied in individuals.
Absolutely, and understood. And I think we can all relate to that, right? When we feel so helpless, it's actually, in some ways, it's refreshing. It's also a little bit scary to hear, so frankly, that if your child gets really sick with this, that there's only so much that can be done, and to understand that there's some limitations to care. I was just reading from Andrea. She said her son had RSV when he was 1, the scariest moment in her life. And she said that his breaths were 75 beats per minute when the doctor said it should be around 30. So that gives you some perspective. And he was in the hospital for 6 days with oxygen. I mean, and this is just one of many stories from parents. So what can we do? Is there something that parents can do to protect our kids against RSV? I got a great question from one of our audience members on Instagram, just saying, hey, like, do you make decisions like not to travel if there's high RSV rates in the area you're going to? Like, how would you try to navigate this holiday season?
So think about the RSV rates over the last 2.5, 3 years, right? They're down. Why were they down? People weren't traveling. People were wearing masks. People were washing hands. When you went to the hospital, everybody was super careful about who they were letting in, if you had a fever and all of that. That's how you reduce that, right? Those are the things that parents can do. So yeah, if you're going to if your infant is, less than 6 months old, that means the immune system's really not producing antibodies yet. If you're not breastfeeding, right? Because breastfeeding, breast milk has antibodies in it, the antibodies of the mother in it. Those kinds of things, you got to think about the risk factors for the child. And yeah, I wouldn't travel to certain areas. I mean, to be honest, if you're going to ask a question of how do we not get it, that is how you not get it. I am not saying don't live your life, right? I'm not saying that. I am saying that if you're going to ask me the question of how do we not get it, look at the last 2.5 years of how we treated this pandemic. That's how you not get it. You don't travel.
But we had RSV rates at strange times during the pandemic, right? We had those big spikes at strange times still during the pandemic.
When did we have those big spikes? When everybody thought the pandemic was over and everybody took their mask off and they started traveling again. If you look at it, that's when we had those.
Well, I'd be curious to take a closer look at it state by state, because that's when it, in a state like, Texas, where masking wasn't required, versus a state like California where none of the kids were in school. I'd love to take a closer look at that, because we also just saw, just generally, we had these national conversations about viruses, but in general, we know it's very specific to your community. So we did see these higher national rates for RSV at different times. And sometimes it was driven by region, as you mentioned, like whether or not it was the South or it was, so I think that's important to mention. Alyssa was saying, what if your older children have RSV as infants? Do they still have antibodies how much protection do you have against RSV if you've already had it once? And a lot of
Mhm.
us obviously don't know,
Yeah.
because if you had a cold
Mhm.
symptom, you didn't get it, didn't get to the point where you were hospitalized or tested, you may not even know, obviously, that your children or yourself, you've had it before.
Right. Great question. I love that question. Here's why I love that question. It actually turns out in individuals that have had RSV, the antibodies tend to be at adequate levels, I mean, protective type of levels, for about a year. And when you look at the older population, their antibody levels go down below that protection level. And the longer that they go without seeing the virus, right, the more severe their illness can be as those antibody levels go down when they actually see it. So if you have in individuals who are susceptible to RSV, right? We're talking really susceptible. We're talking individuals over the age of 60, infants less than like 6 months, people who have chronic lung disease, chronic heart disease. Those are the individuals that are really susceptible to RSV. Those also happen to be the individuals that take care of our kids, right? My mom is 74 yesterday, the day before, and my kids, are always with my mom. And so they're always sick because they're always seeing their friends and they have these viruses. And my mom is really susceptible because she's over the age of 60. And so those are the individuals that you want to protect. So those are the individuals that are studied in all these vaccine trials and such. I don't know why I'm blanking on your exact question, but I hope I answered
Which
it
was,
very
no,
clearly.
it was a question about immunity. You know
Yeah.
how, like, if you were getting a lot of great stories just shared from parents that are saying, hey, we went through this is scary, they still want to learn about it. Can you, Anna Lee was just asking, can you get multiple cases of RSV in 1 year?
Mm-hmm. Mm-hmm.
What about antibody, like, how good is the protection essentially?
Yeah. Yeah, the protection isn't great. It lasts about 12 months, right? And then all of a sudden, your kid can get sick again. If you've had it once, you're probably more likely to get it again. Um,
Why?
because you're already susceptible. You've already had it. Your genetics, your genetic predisposition has already proven that you're susceptible to severe symptoms. And the people who have severe symptoms are the ones that get tested, right? I mean, let's be honest here.
Right.
People who really have severe symptoms, we probably see people have RSV all the time. It's definitely underreported. There's no doubt about that, right? How many times do individuals come in with a cold or some kind of upper respiratory tract infection and you don't test to see exactly what they have? Yeah, it happens all the time. So it's definitely underreported. But the reason we care about it and the reason why we're studying vaccines in it is because it can cause very severe symptoms, very severe symptoms. And the reason it can, and again, my passion is autoimmune lung disease. Asthma is essentially autoimmune inflammation of the pipes that carry air to the lung. That autoimmune inflammation is activated by specific molecules that we call cytokines. When you have these cytokines activated, you get mucus production, you get bronchoconstriction, and you get coughing, wheezing, shortness of breath, all of that, right? The cytokines that RSV activates are identical to the cytokines in asthma. So that's why these kids produce mucus. That's why these kids get coughing, wheezing, shortness of breath. And so when I look at RSV infection, when I see it, what I am thinking about is an asthmatic child. And I have often wondered, can we use the same therapies we use to treat asthma in individuals? Can we use some of these more advanced therapies to treat kids that have severe RSV infection? It's a very serious question that I have.
Can you
Individuals are,
can you do that, or is that like not allowed? I don't know the rules. I'm like, wow, that sounds like a pretty good idea. Maybe we should try it this winter. Anyone
right.
else?
Right. It's interesting. So the therapies that I talk about are antibodies, right? There's monoclonal antibodies that inhibit certain cytokines in asthma. And we use them in kids who are over about 6 years of age. If you're over six, we can use them. We don't really use them in kids under 6 years of age, right? For whatever reason, we just don't. So I don't think it's because they're unsafe. It's just because it hasn't been studied in that population of children yet. The question that you're asking me is, would you, as a practicing clinician, think about using these agents in individuals who are severely sick from RSV infection that are above the age of 6, right? And
Sure.
the answer to that question is, I would. I would, because I'm thinking about the child, the inflammatory response. I have data that supports the cytokines that are activated in asthma, and I can treat that child as an asthmatic, as a severe asthmatic, if they're wheezing, coughing, shortness of breath, and we've tried other things like inhalers and they're not doing the job, right? So in my practice, within my field of practice, I would totally do it.
Is that
I would totally
allowed? Like, is that something that parents should ask their own pediatricians about, or is that just very specialty for
it.
you?
It kind of depends on um, it depends on the symptoms of the child that's over 6 years old. If this child is producing a lot of mucus, wheezing a lot, yeah, it's within practice. What you would do. Would physicians do it? No, physicians tend to wait on kids. They which is an interesting kind of concept. They really allow kids to get sick. It's actually pretty interesting, right? It's like there are things that you allow in children that you would never allow in an adult because they are so plastic, and you allow them to kind of, they can develop severe illness, they can get sick, and you're like, oh, they're going to be okay because they're a kid and all that. And so I've often wondered, God, are we doing this a little bit wrong by not offering
Well, let
therapy
me
to
ask
these
you a
kids
question on
earlier? It's
that,
interesting.
because there's a great question from Kate who's asking about her teenager. You know, my kids just got through a period of a respiratory illness. It wasn't COVID. At this point, and I mentioned that because when I did feel like I needed to bring them into the doctors, there was a couple days of fever and it wasn't breaking and it was getting a little bit worse. And I was kind of like, I feel like someone should look at them. You know, as a parent, sometimes you're like, you're fine. We'll just wait this out. This time I was like, kind of want a doctor to look at you. I think actually it might be strep. Maybe I need a test for that. So, you know, you do a strep test, a flu test, a COVID test now as just sort of part of protocol. Funny enough, the pediatrician forgot to take my daughter's temperature, so we had to go, which I was like, are you going to take her temperature? I think that would be important. Anyways, just, it's easy. It was at the end of the day, I'm sure they were busy, but there was no mention of testing for RSV. And is that something parents should ask for? Is it because you really can't treat it? Is it just, I mean, as a parent now, just hearing about it in the news, it's just something that may not change the treatment, but might be good for me to know. So what do you think about it? It just doesn't seem like the testing is happening unless they're very,
Yeah.
very severe. And should we be asking for it as parents because of
Yeah.
what's going on?
Yeah, the testing is not happening, and it's one of the things we talk about. And I think one of the reasons it's not happening is because there's not anything you can do about it. Right?
Right.
There's not much you can do about it. So I think that a lot of individuals aren't spending time testing. However, you can use the testing to make a point. The most common test that we check now is a PCR. We do like a respiratory viral panel, which checks for not only RSV, but also influenza, rhinovirus, SARS-CoV-2, common SARS-CoV-2, and pandemic SARS-CoV-2, along with metapneumovirus and other respiratory viruses, a couple others. So I think it's important because then it tells us, it helps lead to the contribution of seasonality of RSV, when RSV season is, when influenza season is. I also think it's important as we, as scientists and clinicians, can understand what viruses are out there and what viruses we need to pay attention to in terms of treatment, right? Whether it's influenza and not only promoting influenza vaccination, but also the use of oseltamivir and baloxavir, whether it's SARS-CoV-2, where we not only talk about vaccination, but we also talk about treatment with agents such as nirmatrelvir, ritonavir, in addition to other types of antiviral antibodies and agents of that sort.
What is baloxavir? You mentioned that regarding the flu. I've only mainly just heard about Tamiflu. What is
Tamiflu is oseltamivir. So baloxavir. So Tamiflu, oseltamivir is what's called a neuraminidase inhibitor. So it inhibits one of the proteins on influenza, on the viral membrane of influenza. Baloxavir is a antiviral agent that inhibits specifically what's called an endocap nuclease. Doesn't matter. It's a enzyme that's used for replication of influenza. Very effective, one dose, great medication to use, and I like it. So you have it there in your back pocket in case you have these strains of influenza that are actually resistant to the neuraminidase inhibitors like zanamivir or oseltamivir or Tamiflu. So that's what baloxavir is.
Sorry to interrupt, but what do we know about the flu virus this year? I know I'm hopping around a little bit, but do we know the predominant flu virus? Do we know if it's responsive to Tamiflu? Again, just equipping parents and are the rest of us because flu's for everybody, as we know.
Mhm.
What should we be asking for? Because the Tamiflu is about shortening the virus, right? That's the theory behind it, is that
Yeah.
that it can do. So how does it fit with this strain that we're seeing?
Yeah, great question. So the influenza strain that we're seeing most commonly right now is H3N2. Now, we are vaccinating against H3N2, and the way that we look at efficacy of the vaccine is we essentially look at a certain animal, doesn't matter, it's a ferret, and we see the common viruses that the ferret's getting infected with. We test that serum. And we're like, okay, these are the strains of flu virus. These are what we put in the vaccine, and then we test that serum against infected animals to make certain that it recognizes these flu viruses. Now, for the vaccines this year so far, the vaccines are recognizing this H3N2 about 86% of the time. There was a study that just came out in Chile, which shows that the influenza vaccine this year is 50% effective in terms of hospitalizations and severe disease, right? Which means, well, maybe it's going to be that in the US, or maybe the US can be better. Who knows? But they're using very similar vaccines to what we use here. But we do know that we're covering it with the current vaccine, which is good.
So does Tamiflu apply to any of the strains though? Or is that specific to?
So no. Tamiflu is used for every strain,
So it
right?
doesn't matter. Okay,
Every strain. It doesn't matter.
I don't mean to be
Now,
confusing about that question, but because there were other treatments I have never heard about, I just didn't know, is that something that just automatically is handed out if you get, to the doctors early enough, and does it work?
so they test, right? And they haven't done the testing yet this year to see if influenza is resistant to Tamiflu. Last year, the influenza strains that were out there were not resistant to Tamiflu, right? I reported on that last year. I didn't want to say that this year because it hasn't been done yet. If you go to the CDC website, you can see that report hasn't been written yet. So we don't know. Probably isn't resistant to Tamiflu. But with influenza, as soon as you have symptoms and you get tested, you want to get Tamiflu as soon as possible, right? Because the earlier you get it, the better it works. So I would think that what we have to do as individuals, what we have to do as a society, is if we're going to treat individuals who have high risk factors, so individuals that have lung disease, heart disease, immunodeficiency, things of that sort, those individuals, when they start to have symptoms, or if they're around somebody that has influenza or SARS-CoV-2, something like that, those individuals need to get into the doctor, get tested, and get treated as early as possible, right? I'm not going to sit here and say to you, hey, Jenna, everybody needs to get tested all the time. I'm not going to say that, right? Individuals with normal protoplasm that are healthy, exercise, eat right, all that kind of stuff, they're probably going to be fine. They're going to have some symptoms. They're going to be sick. I'm not afraid of being sick. You get sick, you get over it. But individuals that are at high risk, those are the individuals we see in the hospital. Those are the individuals that we have to target to make certain that they have access to therapies, right? Individuals over the age of 60, individuals with those chronic conditions that we know for SARS-CoV-2, that we know for other illnesses.
So my son was coughing in the background. I've called it, just want to full disclaimer, called Dr. Rutland about my youngest before, because he seems to just have a different immune system than my older kids. He gets more affected by respiratory illnesses. He has since he was a little baby. 6 weeks old, he got croup like it was, I've never seen it before. I had two other kids, I thought I was bad, and like I knew what I was doing as a mom, and then totally freaked myself out. But he's just been that way. He's just a little bit different. And I love the sharing from different parents on our message board right now, giving each other advice and different perspectives, because that's how you learn as a parent. I was talking to one of my friends last night at Halloween. We were talking about actually respiratory illnesses. And one of the things she brought up, I said, well, I'm going to be talking to Dr. Rutland tomorrow. She said, here's the thing. She's like, we've had different respiratory illnesses over the last couple months, but this lingering cough that her daughter has, she's like, it just hasn't gone away. It's like 3 weeks and it's still coughing. That's true of my son. He has like a lingering cough, still kind of comes up periodically. She's like, that's what I really noticed that's different. It's like they get sick, but then it just seems to linger. And I'm sure their parents have, experienced that, or you have a friend, your kid comes over coughing and they're like, no, they're not sick. They've had this cough for like a month, And
Yeah.
so what's normal with that? Like, and should you be concerned when you have a lingering cough like that? Is that just naturally part of your body still kind of getting over a virus? How do you see that? Because we're obviously going to see a huge spectrum of really severe respiratory illnesses this year. We're seeing that already, but then you're also going to have those common colds that sort of just hang out?
Yeah, great question. So chronic cough is something that I see every day as a pulmonologist, right? And chronic cough is essentially defined as a cough that lasts for more than 4 weeks, after even a respiratory illness. So here's the thing about disease in general, and I don't know if I've stressed this point enough. Disease is actually your immune system's response to either an antigen, something in the air, whatever it is, or a pathogen, whether it's a virus, bacteria, fungus, doesn't matter, right? Parasite. That is disease. It's your immune system's response. What happens in these respiratory illnesses is your immune system responds. You get some inflammation in the pipes, you get some inflammation in your upper airway, you get some inflammation in your sinuses as well. That inflammation can lead to production of fluid, production of mucus. And remember when I mentioned the term cytokines? So those cytokines can be activated and they can linger. They can linger around. Say you have a child that has allergies, or you have a child that has asthma or something like that, or you don't even know they have an allergy, but they have a mild little allergy and they're kind of a little bit inflamed within their lungs and upper airways kind of all the time, but not serious enough for you to be like, I'm gonna take them to the doctor, try to check this out. So when you get a respiratory illness on top of that, you get more inflammation. That inflammation can stick around. It's like a post-viral syndrome, right? It's kind of like post-COVID, but not severe, right? Not as severe. So you have this inflammation, and there are agents that you can use to take care of it. Now, sometimes your body's going to take care of it, and it's going to go away over the course of time. And I think that the cost in those individuals and those children will go away over time. However, sometimes you need a little bit of help. You need to reduce the inflammation. You want to have the doctor look at the sinuses, see if the sinuses are inflamed. If the sinuses are inflamed, because they connect to your upper respiratory tract here and your lower respiratory tract down there, they can drip fluid on the back of your throat. We call it postnasal drip, and causes you to cough because your vocal cords are irritated. Or you have inflammation in that upper airway, inflammation in your vocal cords, they're irritated, causes you to cough. Or you have persistent inflammation in your bronchioles or your pipes, right? Those pipes are surrounded by muscle, and that muscle's irritated, causes you to cough. Now, when you keep telling me about True's history, right, the more and more I hear about True, the more and more I think about a kid that either has an allergy or may be developing asthma. Any kid that has had RSV in the past may develop more severe wheezing and coughing. We know that is a fact.
So period with that, because that's a question. So from a lot of folks so if you get RSV, if your child gets RSV, they are more susceptible later for other things. Is that
symptoms
true?
Like wheezing and coughing.
Like wheezing and coughing. Okay.
Fact.
Okay.
In terms of a diagnosis of asthma, that's still being looked at. There's some literature that says, yeah, they're more likely to have asthma because they're going to have wheeze and they're going to be diagnosed with it. But some pediatricians aren't going to diagnose them with it because they had RSV in the past. They know the wheezing. So this is kind of like a debate in the pediatric community. What would I do if a kid had persistent wheezing after RSV infection? They say they had an RSV infection at 2, and they come in to my office, and I see some peds, usually it's friends' kids. They come into my office and they're 7 years old or 8 years old and they have wheezing, like they have asthma, right? And I'm going to treat them for asthma. So that's something to look at and it's something to think about. I'm not saying that your kid that had a respiratory infection has a cough has asthma. I'm saying that your kid that had a respiratory infection and has cough has some degree of inflammation or irritation in that upper airway, and you want your physician to be able to look at it, diagnose it, and be able to help you deal with it.
Sometimes it's hard to bring your kid to the doctor when they're not sick anymore and they have this link, but they're fine. They're running around, but then they're coughing. Gwen's saying, this is interesting. She's saying her son was hospitalized with RSV at 2 weeks old. He's 20 years old now. Good job, Gwen. 20 years old, son. That's good. Make me cry. And every cold hits him different than the rest of the family. And she's just saying that as a fact. She's not, trying to tie everything, but that would make sense to you. It sounds like that.
Asthma.
Yeah.
He probably has untreated asthma, which is also a condition that goes overlooked, right? He probably has untreated asthma, and during, probably winter, when viruses are around, he can get real sick. He coughs, he wheezes, he gets over it. During spring, he probably has a little bit more sniffles because of all the pollen in the air. During summer, he's probably cool. If he has a grass allergy in August, September, he's going to start to have a little bit of inflammation, but he can deal with it, right? He has this persistent inflammation that he can deal with it. Disease doesn't read books. And we, as a medical society, have a tendency to say, you have this or you don't, which is totally stupid because the immune system responds differently in different people. So sometimes you have a certain degree of inflammation, may not be a big deal unless they get something on top of it, right?
Okay.
All I'm saying is just recognize it.
So I'm curious about this. We had a couple questions on this, just immunity in general. So obviously when we hear stories about viral infections, the natural line that we hear from doctors and from the press is, oh, well, everybody, was inside and closed away from other people. And then suddenly now the viruses are back and they're back with a vengeance. That's how this Atlantic article that I mentioned at the very beginning was sort of describing it. So that's one theory out there. And I don't mean to say theory to be dismissive, but I also have to ask this question, which is, a lot of people lived in a lot of different ways during the pandemic. And we also know that my kids, when they first had COVID, had zero symptoms. And when I say zero symptoms, like there was no symptoms, not even a runny nose, nothing. I tested them at that time during the pandemic because my husband was positive for COVID and we were all supposed to quarantine as we remember those days. It went that long ago. So
I remember, yeah.
They all, yes, yeah, I called Dr. Rutland, of course. See, this is how we became friends because I called him all the time about all sorts of things, the news and my personal life. But they had COVID. They tested positive for COVID, but they had no symptoms. And so could it be because a lot of kids could have had COVID and not had any symptoms, or we know very mild symptoms? Could the virus of COVID given us could that have affected our immunity in a way that we don't entirely understand right now? That makes us also more susceptible for viruses that maybe didn't change that much, but are just hitting us different because the vast majority of people were exposed to COVID, had an active infection, or at least, were exposed in some way to the virus. What do you think the connection could be there?
So you're asking individuals who have been infected by SARS-CoV-2, are they more susceptible to viruses now because of that infection?
Yeah, exactly. Like, has the rise of a new virus that we've never identified, could it have changed our immunity in other ways to other diseases?
So it's a good question. I think that the way that I look at immunity, right? We as scientists use these general terms that really don't mean much, but the way that I look at your immune system's response to a pathogen is, if your immune system sees a pathogen like SARS-CoV-2, it's going to kind of alter its response and put its energy towards making molecules that can defeat that pathogen. Okay. It's very tough for the immune system, just like anybody else, to focus on 2, 3, 4 things. And so when you have your immune system response skewed towards this, if you see another virus, your immune system's like, oh shit, right? It hasn't been paying attention. And then it has to go the other way and respond to this virus. So I do think that there's some immunity, I don't know, like bias, I guess. You see something so much that you're kind of skewed that way. And when you see the other one again, you're like, oh crap, or you haven't seen it in a long time. Your immune system's like, whoa. And so boom, you get this rush of inflammation and this rush of a response because you haven't seen it, right? Usually with these respiratory viruses, if you have kids, you're seeing them every single year. When your kids aren't going to school and your kids aren't exposing themselves, not only are they becoming weaker, right? Their immune system's not seeing it as much, but so are the parents, right? And the parents are getting a year older, and so they're more susceptible to things and all of that sort. And so when you don't, me too. Tell me about it. When you don't have that exposure, then you're more likely to overreact or over-respond to a certain pathogen, which is what's happening, right? So individuals that say natural immunity is best, they're not right? They're not wrong. It's not like, hey, you're full of shit, because that's not the case.
This is the first time you use swear words, by the way. In all our time together during the pandemic, there were plenty of opportunities that we should all be swearing. But this is the first time I heard you do it. Is RSV just got you fired up, Dr. Rutland? It's just.
I mean, immunology and immunity gets me fired up. I'm sorry to my mom would be disappointed. She's probably going to text me. She's probably watching us.
Yes, because I love your mother. America's
so.
Mother.
If you guys don't know, Jenna and I have gotten a little close over the last 2.5 years. So,
Well, the background to this, the reason is that we were doing an interview and Dr. Rutland's
it's the first time we met, his mother walked into the kitchen, and she's like this beautiful, like she's like a stunning woman, by the way. She like comes in. I'm like, I want to talk to her. Can I talk to her? And we got a little background. Really interesting story about Dr. Rutland, and you could correct me. Was a student that some teachers had concerns about, and your mom was like, yeah, whatever, he's totally fine, he's good to go. And it just made you compete with the rest of the kids, and you did really well in school, and then you get to college, medical school, and you finally get a diagnosis for ADHD. Is that correct? And so
Yeah, the story. Yeah.
your mom's like, yeah, but he was fine. And so boop, boop, there it is, and now he's a doctor.
So yeah, the story is, just so I can give you guys a little bit of my personal life and details. I was 5. Mrs. Palaki was my kindergarten teacher, and I went to Catholic school like my entire life. And you had to take a test to get into the school. And I was taking this test, and Mrs. Palaki was asking me questions, but I was playing with everything in the room simultaneously. And I was playing with all the toys or whatever. And Mrs. Palaki asked me a question. I got every question correct, according to my mom. And because I don't remember. And after the testing was done, Mrs. Palaki was like, he's too distracted. I just don't think he's ready for kindergarten yet. My mom was like, I think he's more than ready. He answered all your questions correctly, and he was able to do the 15,000 effing things that you have all over your wall. That was what my mom said. And whatever, I got let into school. And I don't know, throughout the years, I could only study for like 30 or 40 minutes. But in that 30 or 40 minutes, I could get a lot done. So I get to medical school, and you're overwhelmed with information. And it was the same thing. Like, I'd go to a coffee shop, 30 or 40 minutes of studying, and then I'd probably see, like, I don't know, some girl in a coffee shop and go talk to her or something like that, and BS for a couple hours. This is in medical school, come on. So then I'd go back to studying. So I went to my counselor, and I was like, hey, listen, like, what's her name, Marjorie or something? I was like, Marjorie, listen, I gotta talk to you. I was like, here's what's happening. And she was like, oh, you need to go get tested. So I go get tested. I'm in this child psychologist's office, okay? It's me and like 25 7-year-olds, okay? And they had the little, like, the toy that has like the 4 different red, yellow, green, blue wires and the little balls that go around, like that. Like, I'm sitting there playing with 7-year-olds, like waiting to see this child psychologist and Dr. Kevin Wood. And I go into his office, and this is like second year medical school, so this is 2007. So I go into his office, and he tests me for all kinds of things. And he's like, you've got dyslexia, dysnomia, ADD, and ADHD. And I was like, who knew? So, he gave me medication. He gave me a long-acting Ritalin, essentially. Changed my life.
Really?
Oh my God, changed my life completely. I started to take it, and I could just like, boom, like sit there and focus for like hours and take in all this information. And I can be honest with you, that is when I went like this for studying and really understanding material. I actually went back and taught myself the first 2 years of medical school. Again, instead of memorizing, I went and created the foundational pathways to understand, which is why I can do this and explain it to people. So completely changed my life. Concerta gave me a big headache, so I started to take short acting, and I noticed that Concerta would last like all day, but I didn't need it all day. I needed it for like 4 hours.
To
study. So I started taking short acting Ritalin, basically methylphenidate, and I still take it to this day, maybe once every 2 weeks or so to study for 4 or 5 hours.
What do you, because you do those sessions where you go to the coffee shops and you like to like really focus. You post about it on Instagram and you do your studying.
So yeah, now I just do it in my office here. I just get up at 4 in the morning and I sit at my desk, and I do that pretty much every morning and study. I can study without medication for like 2 hours now. Like, I can do it. So I don't take it every time. I only take it when I need to focus on a topic and almost learn something new, learn a new pathway, and be able to teach it, right? So when I'm presenting at these national conferences or whatever, and international conferences, I'll like spend 4 or 5 hours on my presentation, learn it, and then just kind of go over it after that. But that was my diagnosis of ADD and ADHD. So like, parents, listen to your kids. I am not a big proponent of like giving medication to kids on a daily basis like that. Like, I wouldn't, if my kid had it, like, I would try to support her as much as I could. I don't know if I would be, I'd probably be more like my mom than I think. And I would wait until they got older. when they needed to study in like chunks as opposed to taking this long acting stuff. So that was my ADD, and like I can't tell you how much it changed my life. Like I really can't.
But it's amazing to hear that you went through all the way through school, got yourself into medical school. You were doing fine. You were going through. I mean, you were at your second year. It wasn't like, you know, you
Yeah,
were on the
I
edge.
wasn't failing by any means. Like
Right.
I wasn't. It was just something that I noticed.
It's amazing. I love that story. I can hear that story all the time because I think there's so much to learn there, and probably taught you a lot as a physician too. And interesting to hear about how you would approach your child with it. And I think this is something a lot of parents are dealing with. And especially now there's even heightened awareness because of the time that was skipped inside the classroom. Sometimes it's tough to know, like, if your child is just a little bit behind, if they're having some other struggles. So I just
Oh
think
my
it's a
God,
cool
it
story.
is so hard. I mean, I don't know. I think how old's your oldest kid?
He's 8.
So my oldest is 10, right? And so she's just getting to that part where school is becoming a little bit hard. And so she has this like, she doesn't have this ability to deal with hard things. Like she always stresses out like right away. And you know, I'm just trying to teach her, hey, listen, like, take a deep breath, calm down, like let's focus and let's read this, because she's always rushing, trying to get things done really fast. And I was the same way, right? And I think that's one of the telltale signs is when you know, because you know as a kid, when you know you only have so much time because you can only focus for so long, you rush because you're like, dude, your mind knows I only have 30 minutes to do this because I know I'm going to be all over the place in 30 minutes. If I don't get it right away, I'm like, oh my God. So I'm trying to teach my young child how to do that, right? It's like, I mean, I hate to say it's like training a dog, but I'll make her run around the block a couple of times just to get her a little fatigued so she can sit down and just like, right? So anyway, whatever. Sorry
No,
for
that's
getting into
totally
this
something.
when we're talking about RSV.
Same. There's been many times I've like, get outside, do a lap and come back. So this is this is parenting. This is smarter parent. We went from smarter respiratory viruses to smarter parenting. We've covered a lot. Okay, I've talked to you for almost an hour. I apologize. As always, Dr. Rutland, you're so generous with your time. When you're talking about preparing your kids for school, though, it's making me think of something else. Like, what can we do? You've talked a lot about the benefits of exercise, and exercise is so important for your immunity and how key that is. But is there anything else that you would say to the rest of us, for our families? Do you like zinc, vitamin C, vitamin D? Like, what if we want to fortify ourselves going into this season? What would you suggest?
You know, the one thing is I would definitely exercise your kids. Like I'm gonna say that, and I would make sure your kids are eating nutritious things. I'm not saying don't give them the sugar and all that stuff that kids eat, but I'm saying make sure that you introduce healthy foods early so they're used to healthy foods, right? So you want to introduce the vegetables, and you know, Gerber had it right with the peas and the carrots and all that stuff. Just keep those things going, right? Try to introduce sugar maybe a little bit later, like the candies and stuff, because people are going to prefer that. But introduce those vegetables and everything in the produce section sooner. Why? Everything in the produce section has essential vitamins and minerals like zinc, like vitamin C, vitamin B, vitamin D, whatever. And they help your enzymes, they're cofactors, right? So they help your enzymes function appropriately. Enzymes are molecules that essentially are in charge of activating proteins in your body, activating these proteins when they respond to pathogens, right? Allowing your immune system to be healthy. There's a vitamin D receptor on the white blood cell that allows the white blood cell to go in there, do its thing, and leave. If your vitamin D level is low, your immune system just doesn't function as well. So these are the things that are, you know, that are important. So I would do that. I would take those things. I would exercise kids. You know, I get this question, elderberry, zinc. I don't care. Fine. Give your children elderberry, zinc. Don't care. Like if you're telling me that, oh, when they get sick, I give them elderberry and zinc because it treats them, not necessarily, right? It doesn't necessarily treat them. It keeps their enzymes healthy and functional, but it doesn't treat their illness. So I do think it's important, though, that diet and exercise, and I can't stress that enough, be a consistent part of your child's life. Don't just do it, allow them to do it during PE at school. Take them around the block with you, walk with them around the block, run with them around the block, go kick the soccer ball with them. I travel all the time. Right? I'm always in some other country, some other place in the United States, speaking and teaching. So when I'm home with my kids, they don't necessarily love it, but I'll make them come in the gym with me for like 15, 20 minutes, do some push-ups, do some sit-ups. I'm just trying to introduce that because my mom introduced it to me and it became a healthy part of my life. So
Absolutely. That's
those
great.
are the
My
things that
husband does the same thing. And it's always, there's grunts at the beginning, but then in the end, it's,
you know what's funny? I'll tell you one more story about my 10-year-old. Yesterday, she hadn't run yet, and she runs every morning at 6:30 with our neighbor, with her friend, with her best friend. She's 11, she's 10. Well, she's 10, about to be 11. My daughter's 10. And yesterday she hadn't run all day, right? And the last time I ran with her, she was complaining and crying and whatever. And it was like 2:30 in the afternoon. I was like, Amelia, have you run yet? She was like, no. And I was like, put your shoes on and go on a run right now. And she was like, Dad. And I was like, just do it. You'll be done. She's like, all right. Puts her shoes on, goes outside, does her run. And I kind of follow her for about, I don't know, 5 or 6 seconds towards the end of the street. And she goes, does this block. It's about a quarter of a mile, maybe a little bit more. And then I turn around and I look, and she's like already done. And I was just like, holy crap. Like she actually is improving. She is putting forth this effort and she understands what she has to do and she does it. And so like as a parent, it was just one of those moments where it was like, man, maybe I am doing the right thing. Because you never know.
we get those reassurances so infrequently, but when it happens, it does feel good.
It makes you almost tear up and cry. And I almost cried. I was like, oh my God. Right. And she was just looked up at me and had this smirk on her face, like she wanted to smile. And I was just like, I don't know, whatever.
Was
I'm a weak
she on
parent,
the verge of that 103 fever? Was that the same child or is that a different child?
That's no. The older child, I haven't checked her temperature, but the younger child had the 103-degree fever.
Okay,
The
okay.
7-year-old.
I was
She
like,
doesn't
wow,
run.
I'm really impressed now. I'm like, this is really lovely. All right, well, we'll let you get to your kids, Dr. Rutland. Appreciate it as always. I have a couple questions that did come up on the chat that
Cool.
I'll fire over to you because I think they were good about, when do you know when your child's been sick? Like, when is it actually okay to get them back around friends again? I thought that was a really good one. And we had a couple others that were very specific towards treatments for RSV. So encourage you guys, if you have questions, you can go ahead and direct message me. You can put them on the chat underneath this interview on social media. Dr. Rutland is active on social media. You should definitely follow him as well. And he'll probably jump on and answer a couple of your questions. But
Please do the RSV questions because I am making a YouTube on RSV next week. So just, please send them so I can incorporate the answers.
Yeah, definitely check out Dr. Rutland. He's doing a whole new YouTube series as well with a buddy of his. We hope to have them both on with us. I think it's really great. And we always learn a lot. So Dr. Rutland, thank you as always for your time. Hope your kids feel better. And
I hope so too.
yeah, and just keep us posted on that because we're gonna be worried. And so we want to hear when that fever breaks and everyone's feeling better again. But thanks as always.
Thank you.
All right,
everybody. Take care.
Bye, Dr. Rutland. Thank you so much. Thank you to everybody as well for jumping on with all these great questions. Love to see you share your ideas and your thoughts and your perspectives. I know obviously when it comes to our health, it's something very personal. And there's been a lot of debates over the last, couple of years about how to approach all aspects of our health policy versus our personal health. And these things are different. So thanks for being open and for having these conversations. And we'll check back in with Dr. Rutland. But I thought this was really important. We see these alarming headlines and, scary as it is, and it is scary as a parent, no one wants to be sick. It's just that we just want to be healthy and we want to be able to live our lives. I think the exhaustion from being worried for so many different reasons over the last several years, something that I really feel as a parent. And the way that I deal with that is more reporting and more information. So hopefully this is helpful to you as well. And that you have a source to come to ask these questions, to get perspective from these headlines that doesn't add to your anxiety, because we definitely don't want to do that. We want to be a source that adds actually something positive to your life. So thank you for being here with Smarter News. This video will be posted as always on YouTube. Our YouTube channel is where we keep all of our content as well. And also I'll put it on a podcast. So if you'd like to share it with your friends, please do so. And thanks for spreading the word about Smarter News because that means a lot to us. It makes all the difference. So be well, stay healthy, do your exercise, eat the good food, keep us posted and keep those questions coming. And I'll talk to you soon. Have a great day. Bye guys.